Hi, welcome to You and Your Health. I'm your host, David Bertone. Today's show, we're going to learn about the importance of proper dental care in terms of improving your health and well-being. We're also going to learn about some recent advances in dentistry and how it may be able to help you from a cosmetic standpoint. Our guest today is Dr. David Stramback. Dr. Stramback is a dentist locally here in Old Bridge in a practice family and cosmetic dentistry with his partner, John Nazaro. Dr. Stramback, welcome to the show.
Thank you very much. Thank you for having me.
Tell us a little bit about your background and how long you've been practicing.
I've been practicing actually a dentist for 20 years, but my background, I like to add that my primary education has been here all of Old Bridge.
Wonderful.
My elementary education, middle school, and high school has all been here in Old Bridge. And then my dental background, I went to school at Baltimore College of Dental Surgery in Maryland. And after completion of that, I did an externship at Allegheny Trauma Center in Pittsburgh. And then after that, I became a resident at Robert Wood Johnson University Hospital. That's where I met my current business partner, Dr. Nazaro.
Great. We're going to talk about the importance of proper dental care and how it can improve or impact somebody's health. In general, what are some of the things that people should be aware of when they're thinking about their teeth and their gums to improve their overall health?
I think one of the most important things is maintaining your health by seeking regular treatment for a dentist every 6 months. I think that's the most important. Many people tend to lag and not pertain to that 6-month standard, and I think it's very important because a lot can happen in that time. My partner and I have seen little cavities that have gotten very big. We've seen teeth that could have been saved that cannot be saved anymore. So my main concern is that people aren't coming every 6 months, and it's important because we can pinpoint or nip something in the bud before it starts to become a big problem. Mm-hmm. Regular maintenance and brushing and flossing, it's very important, but a lot of people tend to think that it's not. Mm-hmm. And that, putting that aside, it leads to bigger problems in the future, and and a more costly problem. So we try to get it, nip it in the bud in the beginning.
Have you seen with the economy situation that some people maybe are stretching things in terms of how often they may see you,
yes.
Things like that?
Yes, that's a great point because recently we have seen that a lot, and a lot of patients, I try to explain to them maybe a routine $200 filling can add up to a $2,000 filling afterwards with a root canal and a crown when it could have been mm-hmm. saved a while ago. They're putting that off, but they're kind of robbing Peter and paying Paul, but it's going to catch up on them. But also we're seeing a lot of patients who do have dental insurance are not taking advantage of that at all. Mm. They're skipping their 6-month checkups and cleanings, which are free. They're paid by the insurance company under your insurance plan that you have. And I just feel terrible that the people aren't taking advantage of that. The insurance companies are winning in the overall end because they're not paying out the benefits, and if the patient doesn't go and get their free cleanings and free checkups twice a year and their x-rays, then that's more money that the insurance company saves. Sure. And yet you're having it deducted from your paycheck, whether it's bi-monthly or weekly or mm-hmm. bi-monthly, and it's just another way that they're making money, and I feel you should just take advantage of that.
Well, what about the people that don't have dental insurance and they're considering, well, maybe I should save here or save there or use the money for something else and not really seeing a dentist as frequently, maybe once a year. What are some of the risks of doing that?
The risks of only seeing us once a year is that many things which we could have spotted 6 months ago now could have turned up into be more costly in the outcome. But we have seen in our practice that basically the patients that have no dental insurance are still coming no matter okay. what. They're keeping up with their regular checkup and cleanings, which is good, mm-hmm. and that's part of the overall health condition. I think a lot of patients today who put things off, that's where dentistry becomes very expensive by putting things off year after year, and I'll wait next year, and I have patients that wait another year and another year, and we could have saved them lots of money in the beginning, aren't doing that.
How important it is for people to determine who should they see in terms of a dentist? I mean, we get advertisements all the time,
sure.
Glossy publications, come see us, coupons, things like that. As a professional, I have trouble with that. I mean, I think people should consider, word of mouth or experience.
Yeah, excuse me. I think the best referral at all is a word of mouth. If you know someone who's close to you or a family member or friend who's been to that person, it's basically they've interviewed that dentist, he or she, for you. And I think that's the best type of referral. You know, choosing a dentist, there's lots of different options. You have availability, you know, how often is the dentist at the office? Accessibility is, you know, is it easy to drive into the, you know, establishment? And you have likability. Do you like the dentist? The most important thing with me, and actually my partner also, is that I think the most important factor in dentistry is that the dentist, whether he or she, should really take their time and talk to the patient about what they plan on doing. And I love doing that. I love educating the patients, and I also love explaining to them, and I double check before they leave. Do you understand everything that I've explained to you? And it's just not a, you know, a look-see, 1, 2, 3, and you're out the door. I want to make sure everyone knows exactly what they need, how should they go about getting that done, and then the front desk will take over from there.
Great.
That's to me is the most important, is that the dentist takes their time to explain everything to the patient, so they're not left, you know, in the cold. I don't know what he said, or they have questions later. I think that's the most important.
Good. Now, in terms of prevention for people in the audience to understand, what are the routine things that should be done besides seeing a dentist every 6 months? What should people be doing every day?
Every day, people should be brushing their teeth twice at least. Please at least get 2 brushings in a day. Flossing twice a day. Even if you get once a day, okay, but at least to remove all the debris that's collected throughout the mouth throughout the day with all your meals. Brushing the tongue, using an over-the-counter rinse, whether it be Listerine or Crest. Anything to help control the bacterial count in the mouth is the most important part. And that can lead to other problems. And that's, you know, it's very simple for someone to do that, but in today's society, everyone says, oh, I don't have the time.
They put it off.
And they put it off.
Do you find that, like, right before bed is an ideal time to do things like brushing and flossing and the rinse, where it can get some of the bacteria out for during the night? Is that important?
Yes, it is, because at night is when your salivary flow decreases, or your salivary input decreases, and the saliva is used to coat the teeth and protect them. So I think it's best, even if you were to put something off, wait before you go to bed at night and do your whole routine, although I don't abide by those rules. I'd rather you know, do it twice a day, even 3 times a day, and I have patients that do that.
And some people I know don't floss regularly. It seems very simple, and it can get a lot of things out between your teeth.
Exactly, and that's where we see a lot of the quote-unquote cavities, or we call them floss cavities, or people who don't floss in between the teeth. Those tight junctions between your teeth that trap food, just hold it against the tooth and allow the acids to break down those tooth structures. So it is very important, and I wish more people would floss their teeth.
Okay. It was a good tie-in. We're going to talk now about tooth decay. And what is actually tooth decay, and what's going on?
Tooth decay is actually the breakdown of the enamel, which is the hardest substance in the body. The teeth are protected with that. The acids from whether it be fruit juices or soda or any type of food, the acids will break down that outer core, that outer shell of the tooth, and penetrate into the second layer of the tooth, which is called the dentin, which is the softer tissue. And I always tell patients it's almost an analogy to an M&M. The candy-coated shell is the hard enamel, and the chocolate is the soft part. That's the part of the tooth. Once that bacteria breaks through and gets into the chocolate, it can become a root canal within a matter of months.
Can you show us on the model what you're talking about there?
Sure. This is actually a cross-section of a tooth. And what we have here is the outer shell of the tooth, which is the enamel. And we have the inner core of the tooth, which is the dentin, which has the nerve supply running through it, which has the arteries and veins. So what happens is that as the bacteria penetrate that enamel, it'll work its way into that second layer, and where that beating heart is, or the nerve supply, once it hits that, it's time for a root canal, which, again, I know we've talked about this before. I hate using that term root canal. I wish they used the term nerve removal, because you're really, as soon as people or patients hear that, they get flustered.
Sure.
And
well, we're going to cover the topic of root canal. When you talk about tooth decay, is it mainly just on the top of the tooth, or can it occur from the sides as well?
Oh, it can occur on every tooth has 5 surfaces, so you can actually have decay on the tongue side, you can have decay on the cheek side, you can have decay on the top surface of the tooth, and in between where we don't floss at all.
Okay.
So it has no boundaries.
Got it. Now let's talk about another health risk, is gum disease.
Yeah.
How does gum disease develop? Is it again an issue of hygiene or preventative care
That's a good point. It is part of preventative care, but it also is genetic, in its components. Smoking can cause gum disease. We have a lot of substantial smokers where the tar from the cigarettes actually acts like flypaper to the teeth, and the bacteria adhere to that. The bacteria have acids. The acids break down the bone level drops, hence the tooth becomes loose. So, there's so many factors involved, whether it's diet, hormonal, diabetes, medical conditions, all attribute to the gum disease. But the most important thing is that people don't have their teeth cleaned properly and regularly every 6 months, which is a big factor, and that kind of keeps all the bacteria at bay.
I think you bring up an important point about their health. There's a lot of factors for gum disease. So when you see a person for the first time, you're learning about their medical history and
which is very important, and medicines, correct.
Because it may be an influence on the progression of something like gum disease.
A lot of the medicines today, a side effect is dry mouth. And when you have dry mouth and there's no saliva flow in the mouth, that's an increased chance of the gums becoming swollen. A lot of the bacteria stay in the mouth, and that becomes an irritant to the gum tissue. That's how they become red and puffy and they bleed, but also give off acids, which again take the bone level, which is holding that tooth, and start to melt it away.
Now, for people at home, what should they look for if they haven't seen a dentist in a while for signs of gum disease? Are there clear things that are occurring?
Yeah, one of the basic signs is when you're looking in the mirror or however you brush your teeth is perpetual bleeding in the mouth, a bad odor in the mouth that hasn't gone away. A lot of the odors that are in the mouth can be attributed to many different factors, whether it's sinuses, a deviated septum, whether it's gastric from reflux, diabetes. You'll have that sweet odor you tend to smell in a patient's mouth. Whether a lot of patients today are on these high-protein diets, these Atkins diets, which give off a very sweet odor again in their mouth, and that changes. So you have to look and say, what are you doing differently in your lifestyle? Are you taking any medicines? Have your medicines changed at all? So there's many different factors involved.
So bleeding is one. Puffy gums?
Puffy and swollen, absolutely.
How about the receding when they start kind of going? You see a little bit more bone down there?
The receding is part, but it also can be a part of how you brush your teeth. If you brush way too hard and hold that toothbrush with a full fist, you can be self-inflicting that recession on yourself, whether it be due to the gum disease or not. It could be part of your daily routine.
That's a good point. I think proper brushing is really important here. I mean, you say grabbing it really hard and going across, not really effective,
no,
right?
and it's very funny because righties tend to go left side more and lefties tend to go right side more, but most patients, when they start their brushing, will go to the opposite side and they'll take that toothbrush as hard as they can and start, and then by the end when they're finished, it's almost, okay, it's light touch and then I'm out the door.
Yeah.
No one really takes, which really should be a full 2 minutes of brushing your teeth.
Okay, so
30 seconds on each section of your mouth.
And it should be kind of in one direction. Should it be side to side?
You know what? You can have benefits going both ways, and I feel that if a patient's brushing their teeth, no matter what, they're doing themselves a great benefit. So there's so many different techniques and there's so many different controversies, whether it's side to side. I'm glad that the patients brush their teeth, and that's the most important, is getting the plaque or the food that's been accumulated throughout the day off their teeth.
Yeah, it used to be that they would say no good to that. You basically want a toothbrush in there.
Exactly.
You want to do something.
And you don't want anything that has stiff bristles at all. Nothing like a wire brush, because you brush the gums right off your mouth, right off your teeth.
Very good. Okay, we started learning about the importance of dental care. After the break, we're going to come back and learn about some of the recent advances in dentistry and how it can improve your cosmetic makeup of your teeth.
To learn more, visit drugfree.org.
Welcome back to You and Your Health. I'm your host, David Bertone. Our guest today is Dr. David Stramback. Dr. Stramback has a practice here in Old Bridge, and we started talking about the importance of proper dental care. Dr. Stramback, we mentioned about gum disease, and another important thing that you screen for is oral cancer. Let's cover that.
That's correct, and it's a very important subject to talk about, since a lot of the oral cancer can go undetected for years and years to come. And whether you're a smoker, patients think just because they're not a smoker, they don't have to take that test, and that's absolutely false. There are so many positive results we get from patients who aren't even smokers using the detection system that we have in our office, which is a rinse. It's a fluorescent rinse that we have the patients rinse with for 1 minute, and we shine a light in the mouth, and anything that looks suspicious will actually pop up. And we can either have that biopsied, send that to the oral surgeon, or we can send it to the oral pathologist. And I think today with the smokeless tobacco chewers, the cigarettes, alcohol, it really does a lot to the oral tissue. And whether you have a family history of cancer, whether it be any type of cancer, I think it's so important to be screened for your oral cancer.
And I know you get it early is important.
And
correct?
early is very important, and it's a matter of saving a section of your mouth if detected early. And it's very important. And if people are listening, they should ask their dentist, please perform that on me. Even though both my business partner, Dr. Nazzaro, and I do visual tests, we also provide the oral cancer rinse, which we highly recommend on patients, although some patients don't want to use it, whether they don't want to know that they have it or I think it's mostly a fear factor. But I think if you have a family history of it, or you know someone who is a smoker or a smokeless tobacco, a chew, a snuff type of person, have them checked out at least once a year.
I know I had it done in your office, and it's painless. I mean, it's really just like a vinegar taste. Rinse your mouth, and then you use a special light. Is that correct?
That's correct.
And
the
you're
fluorescent
looking
light.
for cells that may light up.
Cells that look that generally are differential, that are not part of the normal microflora or the actual oral cavity. If you see something different, and the rinse actually has specific dyes in there to pinpoint that. Okay. And it's been a blessing in the practice, and actually we have been one of the first to use this system in actually the state. When the company came out with it, Dr. Nazzaro and I wanted to use that. And it's been great. And it has gotten better over time with how long you rinse for and the actual light. But it's a great adjunct to our armamentarium.
Great. Let's talk about what you use in terms of for tooth decay. I know the old fillings and the mercury controversy, and now there's newer products. Talk about that and the different products that are available to repair the tooth.
Yeah, once a tooth is diagnosed with decay, there are so many different options that a patient has today in the office, whether to fix that quote-unquote cavity. There is still the amalgam issue that patients are worried about, the mercury in the fillings.
That's the silver filling.
That's quote-unquote the silver fillings. Okay. Yet there's still, it's a great material to use. It's been used for a long, long period of time, but over the years it's gotten a lot of publicity with the mercury that's inside of it, because the mercury actually allows that silver filling to be compressible or condense that in a tooth. And many different companies make different types of silver fillings, and how much mercury is in one and to another. A lot of patients are weary of that, so we also provide white fillings, which are the cosmetic fillings, which are a mixture of glass quartz and a plastic resin. Then they have a choice of gold fillings. Then they have a choice of porcelain fillings that are all fabricated by a lab. So choosing the filling, Dr. Nazzaro and I sit down and we explain to the patients their best treatment, what they would like to have, what is in their best interest, and a cost factor, what they'd like.
So there's cosmetic varieties and cost factors.
And also longevity.
Okay.
And if you ask me what is the longest material you can put in the mouth, that's the best, and that's gold. And we routinely do that in patients' mouth, because I can guarantee that gold filling or that gold crown will not break. And
so it's the strongest material.
It's the strongest material in the mouth that can be placed in the mouth, but it's also the most biocompatible. The body just adapts to gold so well, and bacteria does not grow upon it. So it keeps the bacterial count down too. That's why they use gold shots for people with rheumatoid arthritis. And gold is the best material to use in the body.
Got it. You mentioned earlier about root canal, and I know you don't like that term, root canal, but everybody has had an experience with a root canal.
Sure.
And I find it to be one of the most exact sciences in medicine, because it's really the only place in the body where you can remove a nerve and then there's no pain.
Right.
I mean, it's just amazing. So can you just explain to people what a root canal is?
It is. What a root canal really entails, or again, I call it nerve removal, is basically going into the center of the tooth, where it will actually call the beating heart of the tooth, and actually removing the central, we'll call it the nervous system, or the central station where the nerve is housed, or the bundle. And once we do that, the nerve has a little projection that goes down each of the roots of the tooth, hence the term root canal. There's a canal that goes down each of these roots, and in that canal there lies a nerve, an artery, and a vein. So what happens is when the decay hits that nerve and the nerve becomes inflamed, it's time to remove the nerve. And basically just by making a little access hole on the top of the tooth, we take little tiny files which look like mini toothpicks and go down and actually grab onto that nerve and disengage it and remove it from each canal along with the nerve, along with the blood vessel and the artery. Once you have that hollow tube open, you disinfect it, and then you sterilize it and clean it and seal it with a sealer, almost, which again looks like a rubber toothpick with cement, and you seal it shut, and it's virtually painless. Nerve removal or root canals get a bad rap because a lot of patients wait till that infection occurs. Sometimes the infection gets so bad that the infection builds itself a wall around the tooth where the anesthesia that we use cannot penetrate and get the tooth numb for us to do the root canal. And that's why people have really bad experiences from root canals, because they've waited too long. If you catch it early, just by even regular checkups, that little tooth that can become a big pain in the future could be nipped in the bud in the beginning.
What are some of the signs that you may need a root canal? What are the classic signs?
Continued sensitivity to hot, to cold, to sweets, a dull ache, a sharp shooting, again, a bad odor in the mouth, a pimple on the gum where an abscess will actually form when there's so much bacteria built in the inner portion of the tooth. It has nowhere to go, so it finds the path of least resistance, which is it goes out through the side of the tooth and onto the gum. And some patients will say, I have a little pimple on the side of my gum. And we can actually track that pimple and pinpoint where it goes to either of the 2 roots or 3 roots or 1 root.
Why is it necessary after a root canal to have something called a crown? And what is a crown?
Sure. A crown is actually a 360-degree, I'll call it a baseball hat that goes over a tooth. Actually, after a root canal is performed, there is a lag period where even though you've taken out the nerve and the artery and the blood vessel, that tooth over time will become petrified, sort of like a piece of wood or a broken tree branch. It still has life to it, but over time, when that branch is broken, all the nutrients to that tooth are now gone, so the tooth becomes brittle. And having a chewing force, which we have in our mouth, which is extremely strong, eating anything on a brittle tooth can cause that tooth to fracture off completely at the gum line, hence having the tooth removed then. So the most conservative approach is actually putting a crown or a protective coating fabricated by the laboratory over that tooth for protection, so it does not splinter and fracture.
Great. Let's talk about things like bridges and caps. What do some of those terms mean, and why are they
Caps
used?
and crowns are synonymous,
Okay.
and way back when they used to call them caps, and the real terminology is a crown,
Okay.
just like a king's crown on his head, and it basically is a 360-degree structural reinforcement of that tooth. They go synonymous, and usually a cap or a crown is replacing one single tooth itself.
Okay.
When you have a bridge is using 2 teeth on opposite sides of a missing tooth space and actually filing down those 2 teeth to actually make a bridge that gets permanently cemented on to replace that missing tooth.
Okay.
But nowadays, the most recent advancements are the dental implants, which is absolutely a phenomenal adjunct to a bridge. This way, well, the 2 natural teeth on either side of that space aren't destroyed, and you get to save those 2 teeth and yet have a dental implant placed, which is probably the best alternative for a missing tooth structure if you're a candidate for it.
So explain, maybe you can show us what
Sure.
an implant is. And
a dental implant, it's a titanium screw that actually gets screwed into your jawbone, whether it be the top or the bottom. And what it does is you actually implant the screw into the bone, and you allow it to adhere maybe 3 to 6 months, sometimes 8 months, and it depends on many different factors of bone quality that patients have. But once the implant is anchored into the bone, the actual jawbone allows the cells to integrate into the threads of the implant to anchor it in. And then the patient, he or she, comes back after 3, 6, or 8 months, and that implant is uncovered. At that uncovering stage, when you open up the gum tissue and see the implant, you're ready to begin the restoration process, which you actually attach a little piece called an abutment, and that allows you to put a crown on top of that. and hence you have the three-part implant system, which is just a great adjunct instead of having your two teeth on either side of that space drilled down.
So from a cost standpoint, though, I assume there's a major difference between a bridge and an implant.
Yes, there is, and that's why we give all options to patients. A lot of times the implants are not covered by the insurance, whether it be dental or medical.
Is that because it's cosmetic, really? It's
not that it's cosmetic. It's that the insurance companies have kind of pushed dentistry out into its own, and does not want to be part of the medical system, which the mouth is the actually first part of the digestive system. And it's a shame because 30 years ago in the 60s, there used to be everything was lumped together under medical, and somehow medical kind of pushed dentistry out the door, and you know, and it's unfortunate because a lot of patients can benefit if the medical coverage has, you know, coverage for a dental implant. They cover for knee replacements and they cover for hip replacements, and I think there's, you know, it's a great alternative to having, you know, a bridge placed.
And what is it, I'm just curious, what is the cost of doing, just say, one implant? Is it
a normal a fee would run probably about $3,800 in our office, and that's from beginning to end. Once the tooth is
it takes several months really to get to that process.
Yes, and once the let's say if we diagnose the tooth that needs to be removed, we'll decide whether he or she has enough bone there to actually put an implant in that day. Dr. Nazzaro is the one who places the implants, and he'll make the decision whether or not he can actually place the implant the day we take out the tooth, and therefore it speeds up the process. Then he or she only has 3 or 4 months of healing, and once it takes, and then they're ready to have the implant restored. Sometimes there's not enough bone available, and we have to have a bone graft placed in the socket due to a bad infection, due to a bony defect from the tooth, hence from periodontal or gum disease, and we have to let that bony take effect. The graft has to set at least a couple months for us to have enough bone to place the implant in. And again, there's also many other different type of factors involved, whether it's health, bleeding issues, heart problems, smoking, diabetes. There's lots of factors involved, whether medical, whether an implant is the right way to go or the bridge. So what we do in our office is we actually give patients the choice, whether it be removable, whether it be an implant, whether it be a bridge. They can have the decision, and we base that upon whether it's finances and or medical conditions.
Just to close, in terms of some other things that are really popular these days, tooth whitening.
Tooth whitening.
Can you just give us the bottom line to that? How is it safe for people to do things over the counter?
It is safe. The over-the-counter ones, I tend not to, unless they're, of course, a Crest or a Colgate. All these over-counters, which are infomercials, I tend not to know any of these companies, so I tend not to go with that. They are safe. What you're basically doing is opening up the pores of your teeth and allowing all the stains that have accumulated over the years to come out. But what I also tell patients is once you start to bleach, and if you want them white, you're going to have to continually bleach, because you're going to have to avoid anything that has color or dye in it, whether it be soda, soft drinks, red wine, your toothpaste that has color inside of it. You'd have to basically go to a bland or a all-white diet. And that's tough to do, and I can't even do that.
Great. Well, thank you very much for joining us.
It was a pleasure. Thank you very much.
We appreciate it. You heard today from Dr. David Stramback about the importance of proper dental care and some recent advances in dentistry that will improve your health and well-being. Again, I'm David Bertone, and thanks for joining us on You and Your Health.